Good afternoon, everyone. I'm Michael McNutt with Weedy, and welcome to our next session at the Weedy Forum. Well, leveraging automation in the back office is kind of a companion piece to what we just concluded in the other room with Dave Haugen. Allow me to introduce our two speakers today. From Athena Health, Joe Holzschlag, and from Humana, Mayur, could you help me out?
Thanks. It's Deruka.
Deruka. Oh, thank you very much. This one, very similar to the first one. We're going to be listening to how Humana and Athena Health are leveraging automation, this time in the back office. So without further ado, Joe, would you like to go first?
Sure, I'd be very happy to.
Fantastic.
Hi, everybody. Thanks so much for the opportunity to talk to you all. I'm excited about, my name's Joe Holzschlag. I'm at Athena, as stated, and sort of my role is somewhere sort of between the operational team who delivers all the revenue cycle services and the R&D team that builds all the technology. So a lot of the automation that happens at AthenaNet kind of goes through my organization to help be implemented. I'm just going to pull up a document here. Yeah. Give me a little prop here while I talk. I find this topic really interesting. I think patients in healthcare, suffer most from in sort of this punishingly intricate healthcare system, suffer from some of the loss and instability and unpredictability of this system and back office. I think there's a lot of places in clinical transit and on the clinical side where we're doing exciting things with clinical information and bringing it to the point of care, and that is all really exciting. I think all of us, either as patients or with family members or patients that we serve, know of times when patient care has been delayed or denied or deferred because of challenges that we have in the administration of the healthcare system. And I think it is this topic that really talks about how do we address, how are we seeking to address those, that uncertainty, the time delays that we can sometimes have in a way that will decrease patient stress and help people get the care that they need. And it's really our ability to execute cleanly on this system that's going to have an impact on patient care. Athena Health, for those of you who don't know us well, I think we provide revenue cycle, electronic health record, patient access cycle services to physician offices. I think a lot of some of our original innovation was really taking all of the work necessary to solve problems for the providers, our provider customers, and really putting it onto a common platform so that a payment that we're posting for a pediatrician at our largest IDN that we serve is brought on in the same way to the small, part-time pediatrician serving a rural community. And we're able to really put all of that work onto a platform that's common to everyone, and that standardizes the work in a way that really allows us to apply this scale to it. We also take all those pieces of work. We don't think about it as like claims resolution. It's actually broken down in a lot of different sub workflows, and that'll come into play when I talk a little bit about how we've applied automation tools here. I think broadly speaking, when I think about the role of automation, what can automation do in the back office? There's sort of three categories. We can do the work faster. We can eliminate variation, and we can do things systematically that weren't done systematically before. And we can cut cost. It's the first two that are actually interesting for patient care. Third one's great, and I'm sure Mayur and I both have cost targets, but I think it's that the thing that is that real commitment to mission, and the reason that I am excited to come to work is really being able to apply these to the simplification and the streamlining of the healthcare system that's really motivating. I thought I'd take a minute and just walk through a couple of use cases. I'm happy to dive into others as folks have questions later. I just want to talk about a couple of places where we've applied a couple of different automation disciplines to Athena's problems. I will say at Athena, everything that you kind of see on here I probably didn't get everything. I think there's a couple of people from Athena on the phone right now who will probably give me a hard time via Teams that I missed a couple of categories after this. But there are different divisions at Athena that apply this information differently. So for instance, we have a data science team, artificial intelligence, natural language processing, and just use of data is really their domain. With lots of other teams that build rules or build decision modeling, or do payer research to create systems that also apply here. So it's really our approach to automation is really applying it everywhere. Because we have this scale, it is in our best interest to drive customer outcomes to apply automation. I think the first place I wanted to start, just give you an example of a place that we've used, in particular machine learning, is our document services. So at Athena Health, part of your electronic health record is our customers send all their, we're responsible for pulling in all of their clinical information that they get across the spectrum of care. So we get lots of stuff via interface, like lots through interfaces. You guys work in this space. We get a ton of clinical information through interfaces, and we have an entire division whose entire responsibility is just to build up those interfaces with labs or health systems or everything that we can find. And yet still, after all of that, we get, I think last 12 months, we've gotten 165 million faxes with clinical information on it for patients. That's our responsibility to handle. In the past, we mostly used people to address that, try to break the workflow down, use QA and other approaches to solving this. But those of you who spent a little bit of time in, around artificial intelligence, like that's a lot of data. You do like a 3 or 4 year look back period on our clinical documents, and you're looking at well over 500 million documents to learn from. And so if you're like me and you are on the first day of kicking off that project, you would probably think to yourself, this is very exciting. We're going to automate like all of those 165 million documents. Maybe there'll be a few left over and we'll just do by hand. But I think as we got deeper into the project, we realized this is actually a lot more complex than it looks. If you think about the actual document services problem, the first thing that happens is you get a PDF in, you get a fax in. And the first thing to learn is who's in this fax? Is it one patient or is it multiple patients? Do I need to split this up? And the second is, who are the patients here? Can I find them in Athena's patient directory? And next is, who's a provider? And then you're trying to categorize the document. At each step along the way, machine learning can provide a confidence interval. This is going to be successful. But if you put all of these different steps together, you get an automation rate that's substantially less than all documents that are automated. And yet still the benefit of the machine learning is enormous. So what it has done, that is sort of to my earlier comments about the value to patients, is that it has eliminated uncertainty and error and variation in the system. So now we have a system where when a document comes in, if the category is clear, we're able to clearly set a category. And we only send to a person where the category is unclear and they need to make a determination. And so what you've done is taken the random error that exists in any sort of people-powered system. You've separated in things that can be solved systematically with things that need actual people intervention. They can actually focus and address complex issues. So you give people complex issues and you give machines the things that we already know how to solve. Another benefit of that has been, in addition to just reducing error, has been business continuity. And this is the case all the way across the board. I would say every single one of our proposals internally about the importance of adding automation to a problem almost always starts with its impact on business continuity. So on COVID week, which you guys probably all remember, the week that like it went from being in the newspapers to being on everybody's front door, we had all these people to redeploy across, from all of their, all of their workplaces into homes and out. And that ability to put a clinical document in a patient's chart so that the physician can treat them is a paramount concern. Because we had this system of automation and because we had people there to solve the rest of the jobs, we were actually able to keep pace with we didn't miss a beat on our turnaround time with these documents coming in because we had this backstop, this acceleration of the machine learning system that was able to flex with demand and was able to be running all the time as we got people back into the right spot. And to me, like, cost benefit's been great. Eliminating error, I think, has had a lot of incremental benefit, both the back office process as well as helping patients, but really being able to keep things together through interruption has been a pretty incredible benefit of it. If I can use another example, we have denials management service where we're, get claims denied, help handle them on behalf of our customers. This is a place where RPA has featured heavily. Again, during COVID, the whether it was telemedicine or it was patient insurance for testing, the evolution and the rapidly evolving situation meant that our engineers, amazing, fantastic. It also takes a long time to plan, it takes a long time to execute. And the situation was evolving faster than we could build, than we could really apply engineers to the problem. RPA was much better suited to a very, very dynamic environment because bots were much easier to put into practice. They were able to, we could spin them up against a new problem of a modifier that was required on a, for a telemedicine visit and get those turned back around, for instance, to our colleagues over there at Humana quickly, so we get patients' care resolved and payers and providers, as they're in the middle of this, really uncertain economic time, could get them paid. And so the RPA has been incredibly helpful, almost entirely internal to AthenaNet. We probably have a few, but there are not almost any places where RPA is going out to an external system to pull data in. It is really used as an internal way to route work around, to set correct status, to enforce policy, and to just do the work that we can't move fast enough otherwise through typical tools to apply. We are also, one of the things I kind of wanted to highlight is, on RPA, I'll say, it's our product managers, have they've sworn that they will put the RPA team out of business. That's kind of the goal, which I think is great. RPA is always going to be able to be on the cutting edge, solving problems that the R&D organization can't. They just can't get to all of these. And I think that's that commitment from our R&D organization to come back through and pick things off that, okay, well, we should actually make this just part of the software instead of using RPA for it. That's created a really good dynamic with within Athena. The other thing that we are working on at Athena that I think is an important, cousin to RPA or something is really in the rules and decision modeling space, which I think isn't, maybe we don't think about it quite as much as automation, but there are a number of places within AthenaNet that, once certain conditions are met and satisfied, we should do the next thing with it. It might be on a call with a payer, here's the call script. If you learn this, go to this way. If you learn a different thing, pursue this line on tracking down a remittance. But often it's within AthenaNet about statuses to set and things that need to happen. And I think it's actually this decision modeling and rules are increasingly important as a midway, as a kind of big business configurable logic. And I know on the phone, there's lots of different health systems and payers and vendors like Athena, and I think really looking at where are you able to create business configurable logic is actually a really nice midway point. It's really easy to govern, a little bit easier to govern than I've found our RPA teams to be, and can help do things that that aren't appropriate for engineers to go build out. Happy to answer lots of other questions, but I want to leave plenty of time for Mayur to talk about Humana and to jump into some questions. So thanks, everybody.
Okay, let me try to share my screen. Let me know when you can see.
Perfect.
Okay. So Joe actually touched on a lot of things around automation, and so automation actually means a lot to a lot of different people, right? So when we talk about automation in IT, you've seen in those earlier presentations, you've seen automation around chatbots, you've seen automation around rules decision making. Where I primarily focus and my team primarily focuses on within the organization is what we call intelligent automation. Uh, so there are really two facets of intelligent automation. There is the robotic process automation, and then there is the cognitive portion of it. So for people on the call that are unfamiliar with what process automation is, it's essentially the core of what RPA can do for your organization. So we take a look at all the processes that are repetitive, that have a certain consistency in them, and we automate those processes, right? So think about things like where a user in their workflow has to reach out to a couple of different sites, and where their pattern of finding information is kind of the same, right? So it's more of a more consistent process that you can take, and how do you digitize the whole process? So the benefits of doing that is obviously what Joe mentioned is your variability goes down, your service quality increases. Obviously, since these are bots and they're digitized, you can do more of it, and so there is a perception of cost savings to these processes, but it's also really about value addition. Where does cognitive come in? So you take the robotic process automation, whatever you automated as part of your a normal RPA process, and in some of those processes, there is an opportunity to add intelligence to that process, right? So let's say if you have a process where you're scanning a lot of documents, you could infuse cognitive elements in there where you learn to read that document, where you look for patterns within that document, and where you're able to increase that accuracy aspect of it through machine learning. So primarily in Humana, when we talk about process automation, there is these two branches that my team focuses on. Let me go back. So that's essentially RPA in a nutshell. But how do we enable it within the organization? So in the past, we've been a team, a central enterprise team within Humana, where we interface with a lot of different segments, do a lot of process analysis, look for opportunities for automation, and then we would end up automating a lot of these processes. The change that we are trying to bring in since last year is more focusing on people being able to solve their own problems. Right? So rather than all the work coming to us as a central team and hitting that capacity constraints on our side, we are trying to take the solution closer to where the problem is. So we have this citizen development program where we are doing a very concentrated effort across the organization in terms of upskilling or even sometimes reskilling certain business areas or even IT organizations where they can infuse automation within their own teams. Right? So now it goes from a, hey, we have this solution, can you do some automation as part of it, to as we are creating the solution, we are automating it as part of the process. Right? So that's where our vision as a COE is in terms of the next 3 years, is we want to go from a delivery heavy organization to more of a enablement organization within Humana, and let the different business areas or the IT areas do their own automation. How are we enabling that process? So we are doing a lot of initiatives around training associates on automation tools that we have at Humana, as well as a lot of what I call community of practice mentorship programs, where we co-develop a solution with a new area to show them how it's done. We show them the ropes of how they would do it. And then as they start doing it on their own, my organization then becomes more of a mentor organization that goes in and helps those different teams. So overall, as part of it, why even do RPA? Right? You've heard RPA probably a lot since the pandemic, where other companies have, or other organizations have started investing in RPA. And really, it's the value addition for us. Right? So when we track, we've been doing this for about 15 years now, and we didn't call it RPA at the beginning. But what we have seen trending is almost on all the efforts that we take up, we do an analysis on, is there a return on investment on, because RPA sometimes can be expensive. And so is there an ROI on that effort? And we typically look for efforts that trend in somewhere in terms of a 2x to 4x ROI. And then we average out somewhere around that 2.53 3x ratio. What we also see is a lot of the automations when they go in tend to be one-time automations, but you will see that they stay within that organization within year over year. So we have seen a huge compounding effect on a lot of these automations that we have, and we have some automations that have been running for 7 years now in some of our data-heavy areas. So that's the overall picture of intelligent process automation. So I've had this question asked to me on why would I do this automation to start with, and really the product of all this is what we call as a digital workforce, right? And Joe mentioned that as part of the pandemic efforts at Athena Health, but it's really looking at your workforce in a whole different way, right? Is can you take all the repetitive, the consistent tasks and move them over to this automated bot process, and then have those associates that were focusing on these mundane tasks and put them towards more value-added services. And so that's where this whole concept of digital workforce has come into picture. And now within our organization, when we try to look at ROIs, we just don't look for hard dollar savings anymore. We also look for one of our KPIs is what's the digital workforce enablement that we have done, right? What is the what's the overall ROI in terms of not just hard savings, but in terms of the soft savings as well. Now within automation, there is this, when you look at this digital workforce, there is truly what I call two concepts of a workforce. One is the digital assistant, and then the other is a digital worker, right? And so a digital assistant is where you have more front office scenarios. So think of a call center rep, right? A call comes in, the call center rep is trying to service the call. Our intent as an organization obviously is how do we increase the net promoter score, right? How do we reduce our average call handling time and then still get our member to a very successful outcome of so that they don't have to call us again. And so a lot of our digital assistants are concentrated around the call centers today, where they do simple tasks, as in call comes in, if it's I have to update an address, and as you know, our health ecosystem, our tools are fairly disconnected still. There is modernization efforts that are happening, but we still have a lot of systems that talk to each other on a nightly basis and aren't seamless in data exchange. And so where this digital workforce helps is what we call an attended automation, where the call center rep would then say, okay, I need to update address. I'm going to fill an address on a form, and I'm just going to click a button. And then what this bot does on the back end is it reaches out to these 5 different systems and either updates that address based on an API, updates that address based on the UI, right? But it does all that and then comes back with an outcome. So that's where now you've really reduced that call time, because these things can happen on the background. Another concept is of the worker is essentially a digital worker, where it's not an assistant, but it's more of a native, what I would call batch automation. So if you have scheduled tasks, so there are today millions of claims that we look at on a nightly basis. We have automations, and I'll go over the next few slides, but we have automations that look at claims accuracy, that do frequent auditing on our claims to see that we have consistency and accuracy in our processes. So a lot of these things are happening on the back end every single day, right? And they're running 24/7, and that's where you get the benefit of really increasing your throughput in terms of processing these back office operations. And then the third, as I mentioned, was the cognitive aspect, where today where we are using it in kind of a hybrid model, where you have either an attended workflow or sometimes a back office workflow, but you need to overall increase the accuracy of those processes and learn from learn from the outcomes and continually improve. And so that's where we have this cognitive aspect of automation. There are some use cases that I wanted to highlight in terms of the different automations. And so I'll start with a very simple one, right? And how do you basically save time in terms of, today we have call center reps. We talk about, somewhere around 10,000, 15,000 call center reps, right? And so every single second that you save there is eventually a cost saving to the whole ecosystem of healthcare, right? And so we have an attended automation there where you don't have to start with something really complex. You can start with something really simple. And this is a great example of where you would start, on a simpler process. Is today when they log in to their system, there are these different systems within Humana that they use, right? And unfortunately, a lot of these systems have their own obviously UIs and their login procedures. And so imagine a call center rep coming into work and has to log into like 6-7 different systems. And those systems would have their login timeouts. And so they would have to log in again after some time, depending on how they're servicing those calls. So we have an attended automation today where what we call a toolbar. And so on the toolbar, when they come in, they just say, I want to log into systems. And what this essentially does is on the back end, the bot picks up and starts opening up those sites or those applications and starts logging them into those applications. And a metric where we captured here is in the past 12 months, we have completed over 10 million application sign-ons. So translating them into hard savings dollars is difficult, but when you look at it in terms of the transaction size, you see the impact of those 10 million application sign-ons, right? Where you would have a user who's trying to enter a password, doesn't remember a password, or makes a mistake in typing, and all that is gone now, right? So it's not just about the size, it's about the accuracy of where it goes in. In terms of unattended automations, the batch automations, we have a lot of automations. We have around 1,600 automations today within just one segment of the company. And a lot of these revolve around claims, because that is that's the most volume of data that we see on our side as a payer. So there's tons of examples. Obviously there's 1,600, and I just highlighted a few in here. But one was financial recovery, right? So we have a bot today that goes in, looks for, assists in basically financial recovery processes. So think of capabilities in terms of sending letters or updating data related to financial recovery documents, like changing addresses, action codes, comments, recovery amounts. All this is basically done by these bots. You see the number there. We processed basically 3.5 million claims through this in the past 12 months. Where we also use automation quite a bit is in the adjustment process of claims. So when claims come in, we have all these different variations. So we had a resident staff, and we still do have a resident staff that looks through all these claims and tries to adjust those claims. Now, in terms of claims, there's obviously so many variations that go in. So we picked up 6 variations of that adjustment process that had the most volume, and said, okay, how can we automate this, right? And so some examples in there in the 6 variations was if there are duplicate claims, or if there is an interest calculation in that claim amount, right? So that is something that can be fairly automated, and you don't have to rely on a person doing those interest calculations anymore, right? So again, Joe had referred to some of those rules-based things. So you can take these rules that are consistent and have your RPA processes basically process these rules and adjudicate that claim. where we also saw significant benefit last year was with the pandemic, right? So obviously with the pandemic, there was not only a challenge in terms of the volume of COVID-related claims that we were getting, but it was also, the pandemic overall affected our staffing levels as well, right? Because everyone essentially was affected. And so now we had teams where teams were short-staffed, or they had to adjust to processes in terms of, where they work from and how they work and, what access do they have. And so we fairly quickly, I think it was within a span of 3 weeks, we put in a very robust automation process for adjusting all claims that were related to basically COVID codes, right? And so just within, I think this metric is year to date, I think last year. And so we processed about 2 million claims. And our cost saving, when our business did the analysis of how much staff and how much investment I would have had to make if this was a manual process, then we really saved about $1.5 million just last year. So that's kind of an overview of some of the attended and unattended portions. And then we have some which basically are a combination of these processes. So we have an OTC process today, which is what I call a hybrid process, right? So we have essentially a form for call center users to record OTC orders. And that volume, we have seen that volume increase a lot with COVID. And so now instead of basically having people place orders manually on the phone, you let basically this unattended process take over and send this data to our pharmacy order system. And we built essentially, the primary team built a dashboard to look at the backlogs for this process. But we were able to quickly process all these OTC orders as well as part of that process. Now, when we take it a step further and look at how we do prescription fulfillment. So this is a very interesting use case because it was fairly complex for us and it had the cognitive element in it. So this typical use case is where we receive a prescription for a member and the drug is not on our formulary, right? So there was a fairly manual process once this happened, where we had staff look at what drug was prescribed. Are there alternatives for this drug? What are the suitable alternatives? Which should eventually we check with the doctor and then process. And so all that, when we look at all that process, and this is still kind of what I would say a work in progress because of the cognitive side of it. But now we at least have a process where when these prescriptions come in, we do a match on our formularies. And we see if a drug is not on that, then we disposition that. The bot also looks for alternatives and then comes up with basically a suggestion of these are the alternatives. Where we haven't automated the processes, we haven't automated the fulfillment process of it, because we still want our staff to look at what those alternatives were that were suggested. But the learning component that comes into this whole process is we process how the manual selection is done. And so our model is continuously learning in terms of, I saw this drug and I came up with these 5 suggestions, but then I saw this drug being fulfilled as part of this prescription. So now I'm going to remember this and I'm going to learn this and I'm going to keep learning, right? And now when I start seeing more success rate on this is really an alternative for this. Now this is basically some piece of data that we can look at and look at, does this make sense now for it to stop learning and actually automatically process that part of it? So these are just some use cases that I highlighted in terms of what we do in terms of automation. When we talk in terms of revenues and volumes, today on our automations, we typically look at a run rate of, at least year to date in terms of $35 to $40 million in savings. And this is annual year over year. So, once these are built, we look at them once every few months, once every few years, and look at what improvements can we do in the process or have conditions changed. And then do a reevaluation of should this process even be automated anymore. So that's pretty much what I wanted to cover overall. Happy to take any questions.
Mayur, thank you very much for a fantastic presentation. I'd like to hand it off to Dave Haugen, who's one of our WEDI board members and also moderated the front office automation session. Dave, did you have any questions you'd wish to ask for Mayur and Joe?
Yeah, thanks, Michael. Again, I'm Dave Haugen, WEDI board member, and I was moderating the previous session, which was entitled Healthcare Automation at the Point of Care. And it was a great session, but it went long enough that we didn't have a chance to dive into some questions. We had some prepared that I think are maybe relevant for this one as well. And you may have touched on this a little bit, but I'm just wondering if you could kind of recap for us from your own point of view, how would you would really assess the current, what we're calling the healthcare knowledge supply chain? And are there some examples of where it seems to be performing pretty well and some areas where it isn't performing as well, and kind of what that means for us?
I'll give Mayur a break. Jump in first here. Places that it's performing well. I mean, I feel like I've been in the industry long enough that I can remember when things were a lot worse. And I can remember when we had less, whether that's, mutually supported standard transactions, available APIs, the pre-Da Vinci time. There's a lot of places where I feel like we have made a lot of progress as an industry trying to simplify. I mean, we used to print a lot of claims, and we don't talk about that anymore. And I know that those are kind of old, but they have moved from immature and evolving to places that we're trying to improve yield. And I think that that's worth, given the number of players that need to actually make this stuff happen, the fact that we don't talk about some things, I think is actually a pretty solid win. And we probably all spend most of our time thinking about what we need to do next and all the things that are broken. If I had to, pick a few places, I'm really interested in the enrollment space. So specific to this, all of the things that we've already done really well. One of the biggest challenges, I think, is actually getting the full yield out of the work that we've already done. And enrollment tends to be the, it's a yield loss right off the bat. It's a headwind right off the bat when, most of Athena's paper or phone or, all of the worst workflows, most of them are driven by gaps in enrollment and the enormous amount of work that's still quite manual that needs to go into actually even realizing very basic gains that we've all made. So that's a place that I feel like is, it's not a new work stream, but it matters for every single other thing that we all decide to do. That's going to continue to limit the rate there. A little bit of a deep cut. I feel like we've done great on, exchanging information about claims, except in the place where clinical documents are required. Good gumdrops. We print a lot of clinical documents and put them in the mail. Despite all of the work that everybody at Athena is doing to try to make things electronic, we still print out a lot. And it just makes for a slow revenue cycle. I know Mayur hates it, or his colleagues hate it when we mail them things, but that's, being better at both solicited and unsolicited 275 just feels like a wonderful place to just take the edge off of some of these challenges. I've also, spent the last decade in prior authorization. It's probably a place that, despite lack of adoption, I'm thrilled about the attention and progress being made there. I think it is a extremely difficult problem. I'm actually much more interested in, when a nurse at Athena calls up a nurse at Humana to talk about whether or not something is medically necessary, that's actually a pretty high value transaction. That's like a reasonable person would say, well, it's good that they're talking about the appropriate course of treatment for this patient and what's sort of medically appropriate. That's not the prior authorization challenge. Mostly the prior authorization challenge is about uncertainty and where is this authorization and is one on file and is one required. Just like I would like to solve the dumbest, worst problems of prior authorization because I think they're simpler. And I also think that they're the source of far more aggravation than this core question of what is medically necessary here. Those would be my 3 spots.
Thanks very much. If I could just follow up, we had a question from the audience just for clarification. When you mentioned enrollment as a big challenge just now, we were just looking for some clarification about enrolling in what, especially if the audience maybe is thinking of payer enrollment. But if you could just help us understand that or clarify.
Yeah, so when we're bringing a new customer on, or we're adding a provider, we're adding a department onto, our revenue cycle services, all the enrolling that provider with a new place of payment with all of the payers that they're related to. It's really that whole process of, changing where the claims get submitted from to. And, Yep.
Great, thank you very much. Appreciate it. Just another couple of sort of follow-up questions. So in the previous session, which was entitled, automation at the front office, it was maybe a little bit easier to see some direct connection with the patient, given that the focus of the conversation was sort of front office. Can you help us again understand, even though this is back office and kind of inside baseball and deliberately, preferably invisible oftentimes to patients, where this strikes home for patients, or where they may hopefully notice something or notice that something that wasn't working before is now working? You have some thoughts on that for us?
So I can probably take this as, so to start off with, any automation, right, at either the patient side or the payer or provider side, it eventually trickles down, right? So you automate either at the point of care, you automate back office, though some things are visible or not visible, you will see that flow through the entire value chain, the way I look at it. Some of the benefits, I would say, for both patients and payers that we get from a back office automation is essentially an improved quality experience for them, right? So when we automate things on the back end, which are not necessarily visible to the member, what we are truly doing is we are increasing the predictability of the outcome, right? So we are improving the quality of that outcome. We are looking for how do we reduce waste in that process. So be it either a skill waste or a time-based waste to what Joe mentioned, right? Is how are we digitizing more and more of it so that we don't have to handle all these manual processes, right? And so in effect, what we're truly doing, and though it's not necessarily visible, is we are trying to lower the cost with healthcare, right, as part of this process. Also, I think some of the things that happen with these automations or with the whole digitization of data is as organizations, we are able to derive more insights from this data and do interventions at the right time, right? So be it at when a nurse is contacting a patient and is building a care plan for that patient, right? Do they have all the data that is there within the system at their fingertips to essentially come up with a much more reliable care plan, right? One of the examples I had, I was talking to a business user a couple of months ago, and they asked me, can you automate? So we have nurses talking to our members, and they take notes, and every nurse takes notes in a different way. Is there a way that you can transcribe this whole process for us and automate it and look for
Mhm.
either keywords or indicators that we can directly map into a care plan, right? And so that's the whole aspect of automation, right? Is whether you're increasing a digital workforce or you are doing a backend optimization, it's basically for that improved quality. It's for a better outcome for the user. And I have tons of examples that I can go over, but like I brought up that COVID example, right? And patients are sensitive today. They have access to so much data through either insurers or through their doctors, and the accessibility of data is key to them, right? I got my health check done. Immediately after I was done, I was opening up my provider's app to look at what are my test results,
Mhm.
right? Uh,
Mhm.
and then since I have a Humana plan and I'm a Humana associate, some of these metrics carry over, right, in their rewards process. And they look at, okay, Mayur has a healthy blood pressure, he has a good sugar level, right? Looks like all his stats are within this. uh, can we give him more points for these activities, right, that he can redeem for other health related things? So it's that overall aspect of, what do you automate, where do you automate it, and eventually, no matter where you automate it, at the point of care or behind, eventually the whole intent is a better outcome for the consumer, for the member.
Mhm. Great, thank you. I think Rob Tennant from Weedy also had a couple of questions. Rob, do you want to ask a couple of questions?
Thanks, Dave. Yeah, I just want to start by saying, Joe and Mayur, just a fantastic presentation. And I wanted to bridge comments that you both made, because Mayur, when I saw all of your use cases, what jumped out at me was the pain point that Joe mentioned, of course, prior authorization. And Joe, you mentioned situations where clinicians from each side would need to get on the phone and discuss the particular scenario. But that's probably what, a few percent of the real world of prior auth. Most of them are simple. And I'm wondering if there's an opportunity to automate that. You wouldn't be able to automate all of them, but let's say you automated 50 or 60% by simply using what you're already doing for other types of situations, like for claims. So is that in the offing? Is that something that we can look forward to in the near future?
Yeah, I think there are definitely opportunities around the prior auth process. Like Joe mentioned, it's fairly complex today. It's a big thing for everyone to tackle. But there are similarities, right, that we can draw. So when we do these automations, what we also do as part of the process is, when we do automation in one of the areas internally, we try to take those automation ideas to another part of the area, right? So let's say we do something in claims processing. Can we take that idea and bring it to our clinical teams, right? Or can we bring it to our Humana at Home team, for example, right? And you will not necessarily see a 1:1, but you obviously see some similarities that you can pull over. Like I'll give you another example of claims where we try to bring in, we do an automation where if we identify that a member is part of a transplant process, then all the claims that come for that particular member, we have an automation that basically routes it to a special transplant team, so that they get the care that they need at like immediately, right? So it's like a special process within. And so to your question, in terms of prior auths, there are opportunities that we can look at and see these are fairly standard, let's say, auths that need to go in based on a particular set of factors, right? And can we start automating part of these processes within that help the overall process, right? So definitely yes, and definitely something that we keep looking at, right, within the organization.
And at Athena, so our responsibility is to work with the payers on behalf of our providers to get the prior authorization. So I think the challenges that their providers have about the sort of dizzying array of medical necessity guidelines that are in the industry are the same ones that we deal with. And I think our so we absorb all of those challenges. The way most of the conversations that we've been having with folks who are interested in sort of
Anyone else want to drop out and this
Make sure to put yourself on mute if you're not talking.
the challenge, I think the way that the conversations have been going have been about incrementally working through the complexity of automation. So first, can we automate, whether or not authorization is required, which, you talk about like, can we automate 50 or 60% of the problem? That's like a lot of the problem is whether or not a specific CPT code for a specific plan and employer requires authorization. So that's a good place to start so that we eliminate some of the sort of the worst discussions back and forth. And then which are the, and then starting to pick off, well, which things can we automate with a simple exchange of codes? So which things can be automated with a CPT ICD match? Okay, well, that's a super interesting, like a low value use case. Maybe you want to throw all of those out. And I think our conversations with some of the partners that we've been talking about, both on the payer and sort of intermediary side, have been about, all right, we all want to automate the whole thing. Let's actually pull this thing apart and work through each of the use cases, because the closer you get to needing to digest a 50 pages worth of a patient's history to justify a transplant, that's a terrible place to start. There's like so many use cases before that actually constitute the way that we should be thinking about sort of deli slicing out the problem.
I've got another question, and it relates to Joe, the three, I would say, touchy numbers in the Weedy audience, and that is 275, the 275. We've heard a lot today, even from Steve, with understanding the need to move clinical data. Tim Kaya discussed it. Dr. Wen discussed it. So I'm going to put on. I'm going to have you put on your policy hat for a second. We've had the 275 out there for more than 10 years. What can we do as an industry to move forward with a solution? And do we need the government to step in and tell us to use it, even though we know there's value to it? And if we don't get that mandate from the government, how are we as an industry to move forward with any solution outside of a government mandate?
This is a great question. I'm not as close to this as some of my colleagues are, but I will give you my my sort of understanding, be interested in sort of audience reactions as well. This is a pretty tactical problem, the exchange of the 275 for claims purposes. I feel like if patient health were at risk, a government mandate would be the kind of thing that would be really appropriate here. If there are use cases that, didn't have to do with inefficiency. I think about like the prior authorization, that is much closer to the point of care and care decisions and whether or not someone can move on to the next stage in their care plan. And so to me, that feels like it's closer to needing more of a boost than administrative simplification. I'm also not entirely clear why everyone isn't jumping at this thing. That seems like any place where we put something in the mail feels like I'm not clear why everybody's not super thrilled about solving that. So there's clearly something here that I think I don't understand. Some of my colleagues at Athena don't fully understand about what's missing in terms of an incentive, because it seems like just if, we're all responsible for cutting costs and have a budget to hit next year that's slightly smaller than the one we had this year, this seems like a great win to start showing demonstration against that. So I don't know enough about the root cause of why people aren't jumping out of their seats to get this done.
Appreciate that, Joe. Let me turn it back to Dave to close out the session.
again, we want to thank you both for your very interesting, very helpful presentations. We did have a couple of additional questions that we weren't able to get to from the audience. We will direct those to the WOVA chat function, and we'll be able to hopefully put those questions in touch with you. But again, thank you very much for a very engaging and very helpful presentation. And now we will move back to you, Michael, for our next one. Thank you.
Thank you, everyone. We'll be concluding this session now. Feel free to jump into the next session. RPA meets EDI, managing exceptions and complex tasks under automation and smart processing, sponsored by NFA.